Okay, we'll start on this side. Where's the microphone? Okay. Okay.
Hi there, so I'm Bethan Emmett from HelpAge International. Thanks for the presentations and discussions, really interesting. I wanted to follow up on the issues of universalism and also political commitment as being absolutely key to implementing these programmes. HelpAge International's against targeting for a number of reasons. I mean, mostly the rights-based, but also just because our practical experience shows it just doesn't really work. For the reasons that have been mentioned, it's quite regressive, it's divisive, it's incredibly costly, actually. And we also think that universalism is more politically acceptable. Of course, the main issue here around this universalism is the cost, and we can't ignore the fiscal space issues you've mentioned. But we look at this in terms of, actually, it's about what you can reallocate within the budget, and this is a political issue rather than, as well as a cost issue. What we're interested in finding out, and it'd be interested, my question actually is, is ODI or UNICEF considering doing any work on this? What about looking at universal social protection as an economic instrument as well as a social instrument? This is about having money multiplier effects and very big economic impacts. I've seen it myself looking at Bolsa Familia in Pernambuco in Brazil. Bolsa Familia arrives, new shops start opening, and I haven't seen an awful lot of research about the use of cash transfers as actually stimulating economic growth, which I think is key to demonstrating to ministers of finance, for example, that cash transfers and social protection in general is something that needs a big chunk of the national budget rather than trying to compete with health services or education. So my question for the panel is, is there any work out there or any plans on doing more work on cash transfers and social protection as an economic instrument and in terms of economic impact? Thanks very much.
There were loads of hands up before, so we'll take them over this side and move down to this side.
Right. I'm Ian Bust from Plan International UK, and I have a question. I'm very attracted by the notion of a development bargain, which seems to have come up in Ghana. That's to say that people have to make promises related to other areas in their life in exchange for taking part in the scheme. And I can consider that this might possibly be married in principle to a universal scheme. You could have a universal scheme in which people had the right to apply, but they would know that when they did so, for instance, they had to send their daughters to school. One could build on this a number of changes which would help to extend in the wider areas which some people have mentioned. The other thing that I didn't hear, but it was mentioned, I think, by Rebecca, was the huge range of what we talk about children. But under the convention, of course, those go right up to the age of 18. And the needs and the problems are very different at different ages. And I think that it might be necessary to go into that in more detail. You probably have to have a broad age classification, or at least a school age classification, in order to try and do it. But I would certainly welcome more work on that angle too. Thank you very much.
Okay. Next to you.
Hi there. Louise Meinke from the Consortium for Street Children. Thanks for some interesting presentations. Just looking at one of the handouts here is about social protection, child protection, how they relate to each other. I'm very happy just flicking through it to see that street children are actually mentioned in this. I was just wondering if people on the panel can elaborate a little bit more about child protection, social protection with specific reference to street children. And also if this has had any impact on the way that UNICEF work with street children in these countries as well. Thank you.
Okay, I think there's two questions in the middle here.
Hello there. My name is Loknath Bhusal. I am from Oxford Brookes University. I am doing my PhD there. And my research topic is somehow related to this. But I am doing same thing in South Asia. So thank you very much for the presentation. But one thing is very fundamental is lacking here, I think. That is the definitional issue. Three concepts are coming and they have been used very parallelly. Social safety nets, social protection, and socio-economic security. Right? So we need to be very clear with the definition of this. And these terms actually have their ideological underpinnings. if we define social safety nets, it is something very neoliberal. It has to World Bank style development intervention that is very targeted. When we say socio-economic security, it is more broader, like universal. And I think social protection stands somewhere in between. So we need to be clear about this. And another is regarding the fiscal space. I think, as it is mentioned earlier, it is the matter of political will. It is not the problem with fiscal viability. Because if we look at a single indicator, that is corruption in many of the developing countries, you would say that there is huge corruption. If we can control part of that, we would be able to universalize all aspects of socio-economic security. Thank you.
Can you make sure the microphone's turned on? I think it is. Okay. We'll take 2 more and then the panel will answer. Then we'll have a second round of questions.
Okay, I'm Mike Joffe from Imperial College. I want to focus a bit on health because we've talked a lot about health but equated with healthcare. And I'd like to hear more about the other factors that affect health, and obviously by affecting health they could have positive spin-off effects on people's greater productivity as well. But there has been some mention of nutrition, but there are a lot of other factors which affect health, and health is not just a question of healthcare, even though that's terribly important. So I'd like to know whether the project or the people on the panel have more things to say about the protection of health, basically.
Okay, and then I think there's a question in the back.
My name is Nanaya Onyantechi from Ghana. I want to know what is being done by institutions like DFID and UNICEF to ensure that policies by previous governments are not abandoned by current governments. Like most of the policies that have been talked about were introduced by the Kufuor administration in Ghana. But there's a tendency on the part of the current administration to either alter some of them or abandon some of them completely. So what do you do to ensure that they do not change?
Okay, I know there's lots of other questions, and we'll have at least one other round. But I'm going to ask the panel. There were about 7 or 8 questions there to respond to, not to all of them individually, but to pick a few and to respond. And I'll start at this end this time.
Is this on?
Yes.
Just to begin with the question that that was raised by Halpage on universalism versus targeting. I think one of the things to really look at in West and Central Africa is just the incredible diversity of countries that we have. And so in some countries, I think, as Tony mentioned, where you have very high levels of poverty, perhaps targeting doesn't make so much sense. But I think in countries like Ghana, where the number of people below the poverty line has fallen dramatically in the last 15 years, it was halved over the course of the 1990s and early 2000s. So now you have about 33% of the population living under the poverty line and 18 or 19% living under the extreme poverty line. I think trying to reach those people through something like cash transfers can be very effective, and you would probably have exclusion errors in the opposite direction. So I think we have to take a case-by-case analysis of that. And West and Central Africa is just incredibly diverse. I think if you look at our fiscal space analysis, you'll see that clearly. In terms of the development bargain that you mentioned from the plan, I think there's been a lot of debate, obviously, for a long time now about whether cash transfers should be conditional or unconditional. And I think one of the things that's sort of interesting about the Ghanaian model, they've sort of opted for a soft conditionality approach. So there's no one actually enforcing whether or not these things happen. But really they're using it as an awareness-raising tool. So focusing on sort of issues of child trafficking, harmful forms of child labor, and birth registration, people are told that this is part of what comprises being a good beneficiary, and then there are beneficiary forums. So every month when the social workers turn up to hand out the cash, there's an opportunity to discuss some of these issues and also to organize complementary linkages. So I think this type of soft conditionality model, it could be quite effective for addressing some of these child protection dimensions. And some countries, such as Peru and Latin America, have already tried this. So I think I would take a bit more of a middle ground on the sort of the conditional versus unconditional cash transfers. Yeah. Just very briefly in terms of the question. Sorry, briefly around the issue of street children. Yes, we do look at it as just one dimension of protection-related vulnerabilities in the project, but conclude that the social welfare ministries that are mandated to work on that have just woefully under-resourced. Maybe there might be small programs in the capital cities, but outside there's usually very little, so it's an area that needs much more attention. But there is a very good example in Senegal, which Paula can tell you more about, where there's a partnership between donors and the government to specifically address the issues of street children. So that's one country we found where there is a successful model. Yeah, and just again, very briefly, the question from Imperial College about other factors that underpin health besides the quality of healthcare services. We do touch briefly on issues related to nutrition, water and sanitation, but also look quite a lot at issues around time poverty that caregivers face and issues of gender inequalities and unequal intra-household decision-making patterns and resource allocation. So that's quite a strong focus of our work.
Okay. So just passing along the panel, you'll come back later. Bex, do you have one or two to answer?
Yeah, sure. I just wanted to pick up on the kind of definitional issue of social protection, safety nets and socio-economic security. I think on the one hand we could get too tied up with worrying about definitions. But on the other hand, there's a clear need for conceptual clarity, and this is especially important in different countries who might have different ideas of what social protection particularly encompasses as well. So I think it's important to keep both in mind, not to worry too much about definitions, but it's very useful having clear boundaries as to what social protection includes and incorporates, and relating that to country specifics as well. And just in terms of you were asking from HelpAge about the multiplier impacts of cash transfers and whether ODI was doing anything. We've actually done some work last year in Bangladesh looking particularly at two phases of impacts of social protection. One was looking at the household level in terms of the protection, prevention, promotion elements of social protection, and the second was looking at multiplier effects in terms of for example, multiplier effects on the local economy in terms of whether it's stimulating food, agriculture, whether it's changing labour markets in terms of what people might be going into or reducing out of in terms of particular labour markets. We're actually just about to conduct the second phase of that, so we haven't got any answers to that yet, but it is definitely on our radar and an important issue to look at as well.
Tony and Robert, do you have a couple of points to make?
There's a gentleman at the back asked something about political continuity with changes in regimes and the continuity of programs. I think actually Ghana is quite an encouraging example in that respect, because the new government that came to power after the elections in December has actually strengthened some of the social protection initiatives that had been started by the previous government, and very interestingly did it in a context of acute economic pressures resulting not just from the current global crisis but also from other macroeconomic problems that had got quite serious towards in the last couple of years. In the budget for this year, the new government announced, for example, a tripling of the budget allocation for the LEAP cash transfer program, which is a very significant expression of commitment, I think. Secondly, it introduced a completely new program for the free distribution of school uniforms and textbooks to 1.6 million children, which is a very important social protection measure. I mean, we haven't discussed some of these other kinds of modalities that might exist, but that I think was a very important initiative. It also announced a substantial increase in the school feeding program, which is another important kind of social protection measure intended particularly to keep children in school. On the question about street children, there is one example, and that is also in Senegal, where in addition to this universal child benefit, which is being designed with the government as a longer-term, more ambitious program, there is immediately on the agenda a program that's specifically addressed to street children, which includes a cash transfer element aimed at trying to make it easier for children to go back to their families. Just to comment on fiscal space and political will, because this issue seems to be coming up quite a lot. There's a tendency on the part of some people clearly to argue that it's all a matter of political will. It's just all you need to do is make the expenditure allocations better and improve the efficiency of expenditure, and it's just all a problem of political commitment. Clearly there is a big element of political commitment, and there are big problems about the inefficiency of government expenditure and a lot of additional resources that could be mobilized by spending the money better. But we shouldn't also lose sight of the fact that some of these countries are extremely poor and face very difficult choices about trade-offs between different policies and programs. And I think that underscores the importance of what Nicola said about a really country-specific approach. Have I got time to make one more comment about conditionality? Because that also seems to be coming up. I think three points maybe to ring alarm bells about conditionality. One is, in some of these countries, the supply-side constraints in terms of basic social services are very important, creating situations where in some of the poorest parts of countries it would be impossible for the poorest people to meet the conditions, for example, to send their children to school or to access health services. So we should be very careful about that. In Nigeria, the COPE conditional cash transfer program is specifically implemented only in areas where the social services that the people are obliged to use exist, which means they rule out automatically some of the most deprived areas of the country. The second one is that nobody knows, there's no evidence globally, that the conditions have any more effect than the cash itself in terms of changing the behaviors. And the third thing is, do you really need soft conditionality, or could you really just engage in awareness-raising activities? For example, the LEAP program has something called beneficiary forums that take place on the payment days for the cash transfer. And those beneficiary forums are an excellent framework for educating and informing people about how they ought to be behaving vis-a-vis their children. And I'm not really convinced that conditions, even soft conditions, are really necessary to get those messages across.
Just briefly, the last two questions are really relating to health. I think fascinating question from Ghana about how agencies like ours engage in these political processes, because one might say that a number of these policies are very much up to the country governments themselves, as to who's going to benefit first from these expanded programs. But I think this is really where these big international agreements come in. So rather than it being seen as, say, the British government coming in and sort of trying to impose some type of health financing system, if we could sort of really rally around the likes of WHO's call for universal coverage of services, and therefore devising health financing policies that will get you to universal coverage the quickest. So we can very much all come together, UNICEF, WHO, the World Bank and all the rest of us, to say really what everyone should be aspiring to, and it should be a right, is to universal coverage of health services or education services, and therefore it's up to the countries themselves to decide how they get there. us sort of helping set the rules, as it were, I think is quite a sort of a good way for us to operate. And also, related to that is this issue about how you impact on health indicators and it being much bigger than just providing curative and preventive health services. And indeed, I think, that's beholden on all of us to get involved, therefore, in discussions around PRSP processes, making sure that the size of the government budget is sufficient to pay for all social sectors, to make sure that these services are equally inclusive in education, water and sanitation, and really means that, that agencies like ours don't just think in boxes of the social protection people, the health people, the education people, and that we sort of try and encourage governments to have more coherent social protection policies. And here very much commend again the work of WHO and these social determinants of health, which is very much thinking much more around things like even income distribution when it comes to health indicators.
Yeah, just a very quick comment about this issue of political stability. That is true also in the other direction, meaning in Ghana we had a new government, but those are so-called democratic countries, but also in other countries, like to take an example, Guinea-Conakry, we may now see an opportunity to start a discourse on social policy that was actually not really possible before. And that's linked probably to the fact that this newcomer may call elections and want to change the situation. So I think the opportunities are always there.
Okay. Paola, who's one of our later speakers.
Sorry, just to comment, I was involved in two of the case studies, and on the issue of continuity, I think something that's very relevant is that part of this systematic approach to social protection, in which social protection is introduced in poverty reduction strategies and as a long-term strategy, and the advocacy has focused very much on ensuring that this is seen as a short, medium, and long-term process to reduce vulnerabilities, has been quite successful in engaging the government. So hopefully these are elements that not only from the government, but also other actors, obviously donors, but also civil society, in which this is pushed on a longer term scale. And I think at least in the countries in which I was working, this was very much seen as a long-term process.
Okay, I'm going to take another round of questions. I'm going to start at this end. I know there were some questions over here. We'll just take the microphone. And then we're going to work through, and then we're going to this corner over here, which I know there were some questions there too.
Samuel from ACF.
And please be succinct with your questions so we can get as many people in as possible.
All your discussion is in states where the state can take a leading role, and I wonder if you have looked at places or regions where the state obviously has no role or very, very limited role. And I just come back from Mali. When you go a day with your four-wheel drive, there is practically no state left for your project. How you would address that with social protection? And then maybe, because UNICEF is here, can you say something more with the link of social protection and MDG 1 and child malnutrition?
Okay, Sylvia Beals, HelpAge International. Just to follow really the discussion about the political will and the comments that have been made by various panelists about the sort of interest and drive in West and Central Africa that you perceive with governments to take on this topic. Not everyone may know, but I mean, I know the panelists know that African heads of state agreed earlier this year a very important sort of blueprint for social protection, which was sort of worked up over the course of 2008 by most countries of Africa coming together to look at what a kind of package of social protection instruments might be. And they came up with something which they defined a minimum package, which would comprise child benefit, social pension, disability grant, health access, and a whole kind of range of considerations, including what Rob's just said, that it's very important for countries to find the fiscal space, if possible, nationally, so that they wouldn't be dependent on external aid. But what they were really looking for was everything that's been said here too: cross-ministerial collaboration, South-South learning, training, capacity building, and so on. And given that this was agreed by African heads of state in January of this year in Addis, under the auspices of the African Union, I'd be really pleased to have a comment from the panelists here, how they think this should be best taken forward. Because all of us in our different institutions are interested in parts of this package, because we're specialists on children or disability or old people or health or whatever. But it seems to us in HelpAge International that it's really important that we pull together and we use this as a rallying cry and also a defining moment for Africa and beyond. And I was also would much appreciate too your comment about political will as informed by and driven by civil society, particularly in West and Central Africa. We know that civil society is sort of rather behind on social protection, possibly because they never think it will happen. But it's so important, and how can we, again, through our different institutions, support civil society to know about this, work with it, and work with all of us to get the political drive that we all want.
Okay, thank you. Over here, these two speakers here.
Alison, UNICEF UK. Picking up on the role of donors in supporting social protection, I was recalling the April G20 communique, which said $50 billion would be available for social protection, trade-related capacity building and other measures. I want to know who is pushing for this money to go to social protection, or more specifically, child-sensitive social protection. Who's making sure this pledge is delivered through an effective channel? Essentially, what's being done to make the most of the G20's promise before it gets forgotten? Thank you.
Wayne Blyer, War Child. I have two questions. One is, with all the critiques on aid and its relation to economic growth in the literature these days, how can we use aid to bilateral and multilateral to encourage social protection? And two, where does microcredit fall in line with social protection programs? You mentioned Bangladesh, and that could be one example, but I wonder what the link is between microcredit and social protection.
Stuart Keane, World Vision. I just wanted to ask, we've talked about this question of political will, and I just wondered to what extent the research has actually looked at the political economy dimensions of all of this, and actually trying to really understand the coalitions of interest that have made this difference. We're aware that ministers of finance have objected in various contexts, and trying to ensure that there's continued support for this. Has this been analysed? And I know that kind of within the Bridge project within ODI that's the kind of analysis that would be undertaken. So it'd be good to hear about that.
Thank you. Just a quick one. It's Angela Penrose, the Grow Up Free from Poverty Coalition. A quick one to follow on from the discussion on the AU's social policy framework and Sylvia Beale's question. As some of you do know, a group of civil society organisations, both Africa-based and INGOs, came together before the Windhoek meeting and took part in all the regional consultations and were quite influential, I believe, in Windhoek itself, so that significantly sessions were chaired by a member of HelpAge International and by Plan International, both very prominent African people in their fields. And they are struggling to keep this platform of social protection organisations going, both continent-wide and at national level. And I'd just like to ask the panellists how this could be supported, because I think if you think about it from the perspective of the Minister of Women, Labour and Social Affairs, to have UNICEF coming at you from one direction and HelpAge International from the other, and then the big income grant people over your shoulder, surely we do need these people to come together and help to forge a national consensus on what the priorities at an individual national level are, so that people really can work together, and what your perhaps advice and experience on that is. Thank you.
Okay, there's some questions over in this corner, or there were. This is the last round of questions I'm taking, so speak now, please.
Hi, I'm Charity Moore from the World Bank, and I just had a couple quick questions. One was, how did you choose the countries to study for the project? Just out of curiosity, was it a strategic issue, or you just wanted an overview? And then also, in the forums that you held in the different countries, what type of feedback did you get back as far as opposition to social protection or cash transfer programs in particular?
Okay, are there any more questions in that area? I mean, that section of the room? All right, we'll move to the panel now, and they'll also wrap up their comments in responding to your questions. So we should start at the other end.
Right, where to plan to these? Well, I'm trying to, I suppose this issue of sort of political will and holding governments, be it sort of AU governments and or donors to account. I think the skill really is to really perhaps focus on one or two really, really tangible social protection measures. I would suggest is the best way to deal with this. I think the AU pledged for this package of social protection measures. I think perhaps there is perhaps a tendency in these big international meetings for governments of all types to sort of come and say, oh yes, we'll sign up to that. That'd be nice and straightforward, and just pile things into these great packages. And then it become really quite difficult to monitor exactly what's going on, and then it's quite easy for these things to sort of fall beneath the cracks. I think perhaps better would be for civil society organisations and both in developed and developing countries to really maybe focus on some real rights to some of these services and issues, and focus on those and perhaps tick them off one by one rather than expecting a package to come overnight. I think that perhaps would too go for the the donors around issues around social protection. I mean, these big figures of $50 billion for social protection. I can imagine, and I'm certainly not going to say DFID's going to try and pull a stunt like this, but that when donors are suddenly asked to say you've got to demonstrate you're spending $5 billion on some of these issues, it's actually relatively straightforward to perhaps look through all the projects and say, well, there's a bit of social protection in that, so we can lob another couple of million in here and reach these targets. So I'd say much better would be to very much focus on say, universal access to education services. And if I can give you one tangible example, actually, to come back to the very first question about what do you do in states where there is, the very failed states. Take the issue of Congo, where I was living till quite recently, where there has been this dreadful situation for many, many years of a dysfunctional state. And the new state is coming in, but obviously large parts of the country are really not, I would say, being very effectively sort of managed at the moment. But where I think, the donors can come in and work with the authorities and take some of these international agreements around rights to education, rights to health, and very much sort of start, say, providing free health services like DFID is doing in Congo at the moment. We are pioneering with NGO partners and raising expectations in those populations that they have the right for free healthcare. Now, if I were being really honest, this is quite a controversial thing in Congo, where fees have become so ingrained, and some local officials don't like this. And dare I say it, some donors don't like it either. And there are donors in neighbouring districts who are charging for their services, who are claiming that DFID is stealing their patients because they're coming to use free health services in our districts or those we're supporting. So I think, that we really can, focus on some of these basic rights, and even in failed states, start, building up some of these rights-based approach to services, and this being quite a practical way of really genuinely bringing up some social protection.
Okay, thanks. Tony, one or two comments, please, to wrap up.
Okay. Somebody asked a question about harmonization among all the agencies that are engaged in this field, or it was, I think, hinting at that. I agree. I think it's a real challenge because there are a number of different agencies pursuing slightly different agendas, placing or proposing different things to the same governments in a context of weak capacity and so on. One of the reasons for establishing the UN Interagency Working Group on Social Protection for West and Central Africa is specifically to address that. And I should mention, by the way, that this group will be open to civil society organizations that have a regional presence in West and Central Africa, i.e. not NGOs that are operating in only one country, but are active across the region. And we want to use that really particularly to try to for knowledge exchange, information exchange, and to try to get us to all work together to help governments in a coherent way. On the choice of countries for the studies, it was we wanted a mixture of both oil-rich and low-income countries, with Sahelian countries, coastal countries, different conditions, in order to be able to see the situation and the potential and the constraints in a range of different types of contexts. In terms of opposition, I think it's quite interesting that there is a growing consensus actually around the importance of social protection, of the potential value of cash transfers, of various other kinds of measures like user fee abolition, insurance approaches, and so on. But clearly, there's a lot of discussion about what is affordable, what would be the best choices to make in specific countries. And clearly, to go beyond these kinds of general studies to actual operational program design requires going into a lot more detail about different specific options. Just a quick comment about the economic issues and the reticence of ministries of finance, which is understandable. I think there are strong arguments to make here. There are arguments about the multiplier effects of the cash transfers themselves. In other words, people spend these, if we're talking about cash transfers specifically, they spend the money, they have low savings rates, these households, so the multiplier effects are quite important at the local economy level. And in addition, it allows poor households to accumulate assets and to increase their productivity and to participate in growth. What I think we found difficult to do is to actually prove these theories with hard evidence. And I think all this really shows is how important it is to strengthen the monitoring and evaluation frameworks for these kinds of programs so that we can really demonstrate what these economic benefits are in addition to the sort of the human development benefits.
Okay, just very briefly, I actually want to echo a bit of what Tony's just said, based around some of the political will questions, but also thinking about how civil society can engage, how the agenda can go forward. Then I think having data and information and evidence is really important. For example, the case study I did was Equatorial Guinea, and although it has probably the biggest potential in terms of affordability, it's very difficult in terms of politics, not only in terms of implementation capacities, but also in understanding the benefits of social protection and different social protection mechanisms as well. And within that, I just think it's important to point out that when we think about what types of social protection, it's also important to think about sequencing of activities, of interventions. In a low-income country, you're not going to be able to have a universal cash transfer and invest in health and education at the same time. It's fiscally impossible. But it's about thinking around the sequencing of these interventions and possibly starting off small and then building up. But I think it's also important to keep realistic expectations of social protection, especially when the cash transfer amount amount in a lot of these programs is extremely small. And if we're talking about moving people out of poverty, I think we have to be realistic about what we can expect people to do with a small amount of money. And it's this broader approach of also supporting livelihoods as well as social services.
Yes. Just a word about the question, what do we do where there is no state? I mean, this is actually a very serious problem. I think if there is no state at all, it is clearly very difficult to implement social protection measure, I mean, for the government. What we generally do, we try to foster and boost whatever is the traditional systems, and therefore start building on those. Meanwhile, pushing the government to extend their range also in those areas. The other issue about the G20, who is following up? Well, I think there are governments that should follow up. We are trying to follow up. The executive director has visited one of the rich countries, and she made the point. We will make the point again and again. But certainly UNICEF strength might not be that terrible, and we count very much on governments that have made that commitment, and they were pushing for that. So I think this is important. About civil society, it's been said that we should increase communication. Okay, I think this is it.
Thanks. Just three very brief points. First of all, around the political economy, yes, we did look into the different coalitions of interest amongst different ministries within the social sector and also the economic sector, and also dimensions of national versus subnational dynamics. So they come out, I think, quite clearly in the country reports, which are not yet published, but we're happy to share with those as soon as they're all out following these national stakeholder workshops. I think this broader issue about how do we capitalize on momentum around the Livingston process and other similar processes is a real challenge. I mean, other work that we've been doing with the UNICEF Innocenti Research Center on what is happening to the visibility of child rights within the new aid architecture, I think really highlights that there is a danger of civil society to be somewhat marginalized. That we have now working groups, sector working groups involving donors and government ministries, but often civil society is at best an observer, not an active participant, and that there are also a sort of a contraction, in some contexts at least, of funding opportunities for civil society. So this is something that we will, we have raised in other work that's being led by Caroline. So I think it's something that we think deserves further attention, and we hope to be doing this through the DFID Child and Youth Civil Society Forum that we're members of, and I think many of you here are as well. And just finally, one thing I think that's critical too is for civil society groups also not to fall into the trap of being siloed. I think often child rights advocates or gender equality advocates, for example, tend to work quite separately. We're just moving on to a new piece of work now on gender and social protection. We think it's really critical that there's much more dialogue across these different types of rights champions to ensure that we really can build on the limited space that there is.
Okay, thank you, Nicola. Before we close, there are two things I want to say. The first is, well, Nicola's mentioned a couple of projects that we're working on aid and child rights, and also a new project on gender and social protection, which are all related, of course, to childhood and social protection. And we're also doing a project for UNICEF again on the crisis, and that will be coming out in the autumn on childhood, gender, and the crisis. So ODI does have an active and growing body of work on childhood, gender, and youth. So please do look at our website. And all these reports that you've heard today are available through UNICEF or through ODI. Secondly, just to remind people that we have a session this afternoon, which we'll have some coffee now and a break. You're welcome to stay. We're going to be looking in more detail at issues of affordability. So if you are interested in issues around universal or targeted social protection, then that would be a session for you. Also on health and another one on protection, and that will start in about 20 minutes. And finally, I'd like to thank the panel. It's been a very rich discussion. It's a very good body of work, and we also rely on all of you to help us take it forward and disseminate it. So thank you all for participating.